Thank you for coming to watch Dr. Smith's video today. We encourage you to hit the subscribe button and the alert button. That way you can get notifications when he uploads a new video. Thank you for coming today.
So we hope you take the time to hear and think about, and if you have a book, read in the book about the concept and the topics that we talk about. They have a lasting effect. The intent is not necessarily to treat pain, but to make permanent, long-term correction with your whole family and your friends.
Thank you. Make sure you subscribe and hit the alert button. Have a good day.
Have a good day.
You're up.
Okay, today we're going to talk about joint replacement. So who has had joint replacement? 1, 2. No. Well, good.
I'm not going
Not after our friends.
to. I'll keep doing my microtherapy.
So we're going to talk about a lot of things, but my goal is to help you understand a little better what you're getting into if you choose to do a joint replacement. But most of all, my goal is to help you and any of your family or friends prevent having the need for a joint replacement. So to begin with, I want to just review quickly, and I'll pass this around so you can look at it close. There are 6 different kinds of joints in the body. They all have a different design. So again, we're back to the concept that the body was made by divine design. And each one of those 6 joints has a totally different purpose and a totally different motion. And they're all important to do what they do. So I'll pass this around for you to look at. I'll also pass this one around. This is another way to look at the joints. We're going to talk mostly about synovial joints. You can pass that around. Synovial joints. So the word synovial is the name of a fluid. I would like to have you think of the fluid as similar in function to a lubricant, like an oil or a grease. And all synovial joints have that in them. And that fluid is contained within a capsule. So this is a description and a picture of the capsules around the joints. They're called the membrane. The membrane holds the synovial fluid in the joint. Now, the synovial fluid is called non-Newtonian. Now, that's not important for you to remember, but the thing to remember is that fluid changes in consistency under different conditions. And you can compare it to ketchup. You have a bottle of ketchup that's been sitting on the shelf, and you take the lid off and it doesn't come out. It's kind of thick and stable. You put the lid back on and you shake it, and now it becomes more fluid, more viscous is the word for it, more thin and more mobile. So synovial fluid is similar in function in that it gets thicker with non-use. It becomes more slick and thinner with activation. And so anytime you move a synovial joint, you help it by lubricating it. Now, a lot of folks, when they have what I'm going to term early joint deterioration. The joints become stiff, they may crackle, they may snap, they make noise. It's because that synovial fluid gels and does not move easily. It also, sometimes the joint gets too tight from overuse. The muscles around the joint pull the joint too tight, and so it becomes stiff and stuck. So that's part of the reason it's stiff. And when you get into a hot bathtub or standing T-zone or do any kind of simple exercise, you think of the ketchup. You shake it up, it becomes more loose, and you get more lubrication. Did that make sense?
Yeah.
You also have synovial fluid in what's called the interstitial tissue. So you have, like in your arms and legs, you have multiple layers of muscle, same with your neck and back. And those muscles slide and glide over each other, like you have short muscles, and you have longer muscles, and even longer muscles, like in your neck and your low back. In fact, in your low back, you have 5 layers, from short, medium, longer, and then longer still, and very long muscle. And they all overlap. They all have that synovial fluid between them. And when they're not used, sometimes they get stuck together. So they don't want to move. And when you first start to move, again, think of the ketchup. You're shaking it up, you get it more loose. So when you do simple things like on the T-zone and you turn, you may be able to turn, let's say you turn this far and you feel kind of tight, we'll stop. And you go this far, stop. Next time you'll probably all go further. Why? Better lubrication. And then the third time, you go even further. So that's why when I tell you to do motion side to side or up and down, whatever you do, I recommend you do it 3 times. And don't try to break the bank the first time. Know that concept that I just told you. The first time has less motion. I'll give you an example. I was putting on a demonstration one time in Las Vegas to a group of students, and one of them was a tennis player, and he said, I have a lot of problem with my shoulder and my rib cage, and I had him demonstrate to me how far back he could move his shoulder. He went to back here and it goes like that. He said, that's as far as it will go. And I said, okay, look, I'm going to show you the benefit of the T-zone. So I put him on the T-zone for 2 minutes. I turned it on a low speed, about 10, and I had him turn his head a couple times each way, 3 times each way. And I didn't have him move his shoulder, I just had him move his chest a couple times each way. Now, I was standing behind him. And I said, okay, now bring your arm back as far as you can. He almost hit me. He goes, he went way back. He goes, wow. I was so dry. It surprised me and him because it enhanced the motion that quick with that simple of an exercise. I did another demo in Ogden with a couple of athletes. One was a tall, skinny kid who played center on a basketball team, and he couldn't jump, he couldn't stuff the ball. He had a few injuries and he got stiff. And I did the same thing. I put him on the T-zone for a couple of minutes and I had just had him raise his arms up, go back down slow, raise them up, go back down slow. Then let him get off, and they said, okay, now jump up as high as you can. He jumped about that much higher than he did before we put him on the T-zone. And it's all related to the synovial fluid in the joints and between the muscles. It's a very important tissue.
Can you lose it?
Lose it
Yeah. Does it go away ever? Like, does it?
when you die,
Oh, okay.
dries up.
I just wondered if for some
Okay.
reason your joint might get dry.
Okay, the simple answer would be yes. You can rupture the membrane. If you had a traumatic, a single traumatic injury, like maybe a car accident that like tore the joint, the synovial fluid would leak out. It's contained within the membrane and within the capsule. I'll pass it around so you can look at it.
Would it come back once it's been ruptured?
Well, it would depend on how bad the joint was torn up. Now, if a joint becomes misaligned and progresses degeneratively and becomes more and more misaligned, more crooked, wobbles more, the capsule could leak out the synovial fluid, and it could end up with what they call bone on bone. And when you get bone on bone, you get inflammation, and that creates swelling. Now, sometimes swelling is a good thing because fluid comes in. It's not synovial fluid; it's lymphatic fluid. Like a clear lymph fluid would come in with white blood cells to kind of clean up inflammation. So the idea with any joint is, whenever possible, catch the problem early. Catch it when it's new. Not often that I will see people and they'll say, would you check my wrist? Or would you check my ankle? It's really stiff. And almost every time when they do that, the joints are not aligned normally. So they're not moving normally. So there's usually a low-grade inflammation which makes them sore. They have decreased supply of synovial fluid in the right spot, and it becomes thicker because they're not moving it. When they get sore, they don't want to do the motion. Now, again, by divine design, I've told you the body has about 206 bones, and every bone is attached to the bone next to it, and the one on the other side, by what? Ligaments. And you have about 800 ligaments in the body. So many bones have multiple ligaments holding them in place, and they all should move. Some of them, as you can see by these pictures, some of them move more. They're designed like the shoulder. The shoulder has probably the greatest range of motion of any joint. It gets a lot of wear and tear. As you know from previous classes, the shoulder girdle floats. Remember the arm, the scapula, the clavicle and the scapula are one unit, the shoulder girdle, and they float around the ribs. So they have not only the joint, but they have a floating foundation, as opposed to the sacrum, which is very rigid, irregular joint that fits between the hips and it moves very little, but it should move always. And it has a capsule, like I showed you in that picture. It has fluid in it, and many times it gets stuck. A part of the sacroiliac joint is big enough and irregular enough in shape that it often becomes stuck on one part. So part of it can move and part of it is not moving like it should. So, having said that, when you do the sacral slide, that's one of the reasons you change the alignment of your feet. You start with your feet up and do them, and then you turn your feet out. When you turn your feet out, that changes the tension in the sacroiliac joint. When you go in, again the same. It changes also the tension in the lumbar spine. And when you have more motion in the pelvis, you have better motion in the ribs. Now, next week, we're going to have some review on some of the home therapy. And I've wondered if this would be too boring for some of you who already do a lot of this self-care. Until Monday morning, I saw a couple, husband and wife, who've been to a lot of classes. They've been coming to me for over a year and a half, and they're doing very, very well. They came in to get their live blood done, and I checked them while they were here. And I was totally shocked when I said, I want to see how you're doing the sacral slide. And he showed me, and I said, you get a C-, because I was not doing it properly. And if you don't do it properly, then you don't get the benefit. And when you do it properly, we're adding synovial fluid to a lot of joints. And when you have more motion, you have more time. When you have better alignment, they last longer. It's just like your car. If the car is out of alignment, what's going to happen to the tires? They wear out quickly. You can buy very expensive tires with them quickly if you have a misalignment in the front end or the back end. So, do any of you have any questions on what I said so far?
On this, how do you say the fluid?
Synovial.
Synovial fluid.
You can call it joint oil.
Joint oil. That for me, that's my speed. My mom, she had all injections in her knee because she ended up getting them replaced in the end, but it was something to do with the cone of the rooster or something. I didn't understand that, but is that like putting the fluid back in there, or?
It's not the same as synovial fluid, but it has a medicinal value.
Okay.
And it has a lubricating value also, but it's not the same.
Yeah, because they ended up having to replace your knees and do.
So I want to talk about what you just said. Many times people will have a minor problem because of misalignment. Because remember what I started to say before, the joint surfaces are all designed to fit the bone that it attaches to. Snugly and smooth. And they should slide and glide. A problem exists when you have one joint, especially in the lower body, like the ankle or the foot, that's out of alignment. Then it changes the alignment of the bones above, like in the knee and in the hip. The hip is very common. It's very common to have a hip replacement. That socket is designed exactly to fit the ball of the femur head. Now, and just so you know, all joints have the capacity, if you have in your body the energy available, and the nutritional building material, your body will build a new joint. Even if you've been told you got bone on bone. If you line it up and do repetitive microtherapy and nurture it over time, it will regrow. It may not be perfect. I'll give you a true story example. I had a lovely lady in her 70s. Her name was Helen. Helen came to me, walked into the office with a very, very painful hip, very stiff, low back, neck, shoulder, a bunch of other stuff. And I took an x-ray of her body standing, and her hip, the femur head, had slid almost out of the joint. So instead of being snug, it's just ready to go like this and slide up into the side of her hip. I said, Helen, you need to go have a hip replacement. She looked at me and said, no. I said, well, if that slips out of there, you're going to be in intense pain, and then you won't have a choice. They will do it if they haul you to the hospital, and they say that they'll fix it. They'll give you a new hip joint. So I really want you to go get it done. She looked at me like she wanted to fight and said, no, I'm not going to go. I won't go have my hip replaced. So thinking like a farmer instead of a doctor, I thought, well, stubborn lady, if I was like you and I didn't want to have my hip replaced, then I understand why. Let me tell you what I would do. So I told her what to do. Here's what I told her. I said, her husband was pretty handy. I said, go buy a pair of tennis shoes, a high top lace-up tennis shoe. Have your husband take the shoe and drill a hole in the bottom of the shoe and put an eye hook on the shoe. At bedtime, put the shoe on. So the shoe's on. Have him put a pulley at the base of the bed, tie a rope onto your shoe. We're going to put a little bag of water on the weight as a weight. So when you go to sleep, we're going to pull your leg a teeny bit. We're going to experiment and see how much water we need so that it doesn't hurt you. I want it to be just a slight snug pull with no pain. Will you do that? I'll do that. Well, let's do it then, Helen, and see what happens. Well, the long story short, Helen's hip pain reduced. She had better motion, and she was happy. I was happy too. About 1 year later, I said to her, Helen, I want to take another x-ray and see exactly what's going on in your hip. So we did. Here's what happened. Her body grew an extension to this joint. So it had grown about an inch extension on the joint. The femur head, which had been all infected and was rough and irregular from inflammation, had smoothed over, and it developed some cartilage-like substance to make it so it was smooth. Okay, so her body fixed it. We ended up taking the shoe off, and she was fine. We're both happy. But that's not the end of the story. About 6 months later, she walked in my office with her arm like this and said, I broke my arm. So I took x-ray of her hand, and yes, she had broken both bones. I said, Helen, this time, go get that pin. She said, no, we fixed it last time, we can fix it again. I said, no, Helen, if you slip, and you pop that bone out through the skin, it's going to be horrendous pain, and they'll pin it. So go get it pinned. She said, I'm not going.
Oh my.
I said, well, then you're going to have to be very, very careful and immobilize it at home. Keep moving the fingers. If there's any nerve problem, if there's any vascular degeneration, then you'll have to go. Again, long story short, it took about a year. It healed. It was a little bit crooked, but everything worked, and she had no pain. So I became very convinced that the body can fix itself if you're patient and willing to work with it over time. Okay, now there's another kind of joint. The joints that are in your head. Those bones, I've showed you the cranium before, those bones are not synovial fluid joints. They have fibrous-like tissue. So they intertwine, the joints are intertwined, but they have some movement, just slight. They don't have to move a lot, so they don't need the fluid. Now, we talk a lot about the microcranial therapy and the suboccipital therapy and the sacral slide and what it does for the sphenoid bone. And I thought for today I would show you a picture of the sphenoid bone. Now, let me ask you this question. Does that bone look like a bat?
Yes.
Does that bone look
Or a spider.
a spider? Does it look complicated or simple?
Complicated.
Extremely complicated by divine design. And that bone touches 7 other bones in the head. And that bone shouldn't move. It's bendable. Remember I showed you the little saddle last week that holds the pituitary gland? It's right in that
Right in the
the
center.
pituitary bone.
Where's the sphenoid?
Where?
Yeah, where point? Is it right there? Right at the back.
If you put your finger here and here,
In the middle.
right there in that low spot,
Yeah,
you know, where you do
Yeah,
the
where we do those.
microcranium,
right.
that spot is right on the tip of the wing.
Oh, it goes right through the middle of your head.
Right there. Yep,
That is one bone, all that stuff?
that's one bone. It goes all the way across. In my opinion, that's the most delicate, specialized, because it contacts so many bones and is designed to move and holds many very, very delicate tissues. Okay? So when I show you the cranium, when we have a class on the cranium, it's the orange bone. The orange bone in the middle that has, when you walk and breathe, it should go like this. It should move. But a lot of people, that's a big, big problem because the joints in the head are too immobile. They get stuck. When they get stuck, they don't work quite right. Okay, back to joint replacement. So the first goal is to always do the best you can to maintain a normal motion between bones. Earlier this morning, I saw a fellow who had in his foot, he had a couple of bones that were stuck together between his second and third toe. Now those bones being stuck together are in the early stage of degeneration. They would continue to degenerate. They were stiff, they were misaligned. It had an effect on his calf and ankle, a lower leg, and a little tiny bit in the knee. So I told him what to do. And it's simple. At home, he could put his foot on a ball and gently roll it to do what? increase motion. We want motion. We want both sides of the body to be the same, so we talk about balance. And then fine-tune alignment. Okay, any questions or comments? We're going to pass out the handout. This is called joint replacement. Why? Cause and effect. So, you got it? Okay. Now, some of these questions and answers may surprise you. Number one, hip and knee are the most commonly performed joint replacements. True. Now, that raises the question, what joints can be replaced surgically? Name a few. Hip, knee,
Shoulder.
shoulder,
My friends actually had her finger.
fingers,
Elbows.
elbows,
Really? Ankles. Can you do ankles?
ankles, yes, ankles. Toes, yes. And when they replace them, if you ask them a question, how long will this last? That's a tough question because it's hard to give an exact answer because they really don't know. But the material should last 15 to 20 years. But many times, I saw a lady last night who had her second knee replacement last year. And she said, oh man, it was a lot different than my first one. The first one was pretty smooth. The second one, it really hurt a lot. It still hurts a lot. But it did help her in some ways because it helped balance her spine. Okay, it helped her alignment. A lady yesterday that was in class that was told when she had her knee replaced that it would last probably the rest of her life. Now I thought, well, that doctor probably didn't think she was going to live very long because she was young enough that for her to 20 years she'll still be around, hopefully, if she takes care of herself. So they don't last quite as long because of many factors. One of the factors is if you have a misalignment in the spine and the pelvis that causes the body to wobble. So when you walk, you wobble. And that wobble causes you to wear out the hip or wear out the knee. They can do a perfect job on the hip. And by the way, they have new techniques on the hip that in the last few years that are far less traumatic than they used to be. They can go in the front, smaller suture, less cutting, less trauma to muscles and that kind of thing, and they heal faster. But if the spine is crooked, they fix the hip, the spine's still crooked, it's going to continue to wear out the knee and maybe the ankle because it's still imbalanced. I've had a number of patients over the years that were scheduled to have a replacement in the hip or knee, and they said to them, first, let's spend some time and see how much correction we can get with the spine and the pelvis before you have your surgery. So when you have your surgery, it has a better chance of lasting longer. So that's still my advice. If you've had anything done or think you might have it done, try to get the spine as neutral as you can. And for those of you who have T-zones, many times does the spine more good to sit on it than to stand. If you have a crooked knee and a crooked hip, a bad ankle, you stand on the toes on a crooked, it doesn't get value unless you stand too long. Now we're going to have a class on the T-zone again next month to review how you use it and how much is too long. I had a lady last week who said, I always use it 12 minutes I go through the whole 12-minute program number 5. And she said, it usually gets stiff. Well, usually gets stiff means you do too much. You have to stay within 2 tolerance. Anyway, so that the whole body works together. And usually a surgeon only looks at the part that has pain. Now, this surprised me. Number 2, more than 1 million joints are replaced annually in the United States, with the goal of 4 million by 2030.
Oh.
Now, what a goal!
Who has that goal?
Yeah.
The joint replacement builders?
Yes,
Jiminy Christmas, thank you.
yeah. And Colorado, we had a company called Synthes. Synthes made joints, that, like I showed you. That was one of the best places to work for. Why? They always had demand of all the joints. They paid high, they charged a lot of money for the joints. And then, of course, the market is going up. The market's going up because we have more surgeons that like to do that. It's easy money.
That one's true.
Pardon?
That one's true. That's
True. Number 3, severe pain is the most common reason for knee replacement surgery.
True, probably.
The answer is true. Now, many times it's not, the knee hasn't worn out. It just has a lot of pain. And pain motivates a lot. And they say, it's worth a try, doc. It's worth a try. Do it. And many times the pain is less, but it's not gone. I had a fellow here in class Monday who had a friend who had both knees replaced. And he asked him, why did you have it done? He said, I had a lot of pain. He said, how is the pain now? He said, well, I still have a lot of pain, but it's less. Would you do it again? Probably not. It didn't change it that much. Number 4.
So does that help with arthritis pain? If you've got arthritis in your knee or your hip, does a replacement fix that?
That's a good question. The answer is this. If you have a local arthritis, which means arthritis technically means you have active inflammation in the joint.
Okay.
So right now it's actively breaking down. If they cut that tissue out, they've eliminated that pain from that tissue. But keep in mind, when you have any kind of a joint replacement, you have just the joint involved. What other tissue is involved?
Yeah.
What?
More tissue.
Muscles?
Connective tissue.
ligaments,
Tendons?
Fascia.
Arteries, veins, lymphatic system. Now, I know for a fact that people have gone to get a simple knee replacement and they die. They die on the table because they have some kind of a blood clot. We're sorry, but during surgery, a blood clot went to the brain and killed them. Or they have a stroke or heart attack. There are a lot of complications. And you know if you've had these done, when you go in, you waive liability. That means that if they hurt you, it's not their fault. You accept results, whatever they are, there's no guarantee. That's you'll sign those kind of papers, right? Yeah, you do that. So it's kind of a gamble. Now, I'm not opposed to I'm not opposed to any of these surgeries. I'm just opposed to mass indiscriminate use. We have a lot of that, like the goal of more surgery.
What I noticed, because I've had both done, but then I had one done again. This time it's like my body doesn't like that in there. Even the tissues around it are just, I can't describe it. They itch and they tingle. It's like they want it out.
Yeah, and that's not uncommon.
Can I
Okay.
give an example?
Yeah.
So my left knee's been messed up since I was a little girl, and it used to swell all the time. And I was very fortunate to have Dr. Smith for a dad, because he would work on it, and the swelling would go away. Every time he would work on it, the swelling would go away. We'd realign my hip and my foot, my ankle, my knee, and it would feel so much better. I've never had surgery on it. Surgery has been suggested to me many times because sometimes the pain is a lot, but it's in pain because it's misaligned. And I come get it fixed and the pain goes away. And I strengthen it. And over the years, my pain has decreased significantly because I do keep it aligned. So alignment can help with that. Like it's if it's not rubbing in places it shouldn't be, it's not going to hurt.
Now, when her husband retires after his second job and they have a lot of money, he still goes to Cancun for 2 months. Will completely heal.
That's right.
Well, we will.
Just need some sunshine and sand.
You got that right.
And
Doesn't everybody?
not re-aggravated.
Yes.
Number 4, there are more hip than knee replacements by ratio of 7-4. False.
False.
It's opposite. Hip 4, knee 7. Choose number 5. Why do joints need to be replaced? Number 1, a local macro trauma. That's where you get in a car accident. You get broadsided and your knee gets smashed or your hip gets broken. You need your son throws you on the floor playing and catching and that's what happened to her husband. They're fooling around and down they went and broke his hip.
Oh, wow.
Macro trauma. Another is repetitive micro motion trauma. A lot of people have stand-up jobs. They require that they turn the same motion over and over and over and over again. That repetitive micro trauma wears them out. Wobbly posture. That's very, very important because that causes tissue to wear out. Now, I've told you and shown you how to self-assess. I assessed a Spanish lady the other morning early, had to walk down the hall. Almost made her cry because for her just to walk was horrendous amount of work because she had so many joints that have been worn a lot and they're crooked. From issue with atrophy, that's another big one as people get older and they get sedentary. Sedentary means they don't move. They sit around. They don't feel like moving for one reason or another. So the joints decrease in the density because when you don't move a bone, the body says, well, if you're not going to use it, let's use the calcium and magnesium for other tissue, and you have less need for the bones to be and the joints to be healthy. Number E, that E is a common problem, nutritional deficiency. Whenever you have, and this is very common, in America we have too much quantity and less quality. So, and Deborah tells me every day when she checks people, they have overloaded their gut. They have too much food, and the body can't handle it properly, so it ends up going into the blood. You end up with a lot of blood pathologies that can be fixed by cleaning up the diet and cleaning out the blood. And you did fantastic. She showed me your results. Now within, what, 30 days? 30 days and some supplements, a little bit change in diet, change her body chemistry, nutritional quality a whole lot. F, total body toxicity. That's when you're too acid. That's why we check the urine for the urine pH. Not enough water, too much protein, cause of body acidity. Poorly fitting shoes. Now, not to be pointing any fingers, but women like to buy shoes that look nice, right?
Can I give you a true story?
Yes.
She
Do you know what you've been dealing with here, my hip and my knee, for several months?
Yeah.
So I've been doing therapy, I've been doing all the exercises you gave me, and it's been feeling really good. Yesterday I got up and I was walking just fine, and I thought, oh, this is great. And we had a funeral, and vanity kicked in, so I decided I'd wear the boots I hadn't worn for a couple of months. I didn't think they were a problem anyway. They didn't ever feel like they hurt me. I put them on. We hadn't gotten into the funeral home, and I was barely able to walk. I was just hurting, hip, knee, everything. I said, Brent, go home and get my little flats. I can't wear these. And so I traded shoes, and then when nobody was looking, I'd do the stretch out exercise and all these different things. And by the end of the day, I was walking fine, and it's like, I wonder if they were the cause of my problem to begin with. I never would have thought. I didn't know they were hurting me.
So what are you gonna do with them?
Well, I was going to send them to DI, but I don't know. Maybe somebody else won't have a problem with them. They're really cute, and they felt good. I didn't know, and I still don't know why and how they were putting me out, but they sure did. It was like 10 minutes, and I was down for the count.
Thank you for sharing that. So for you ladies, you have my recommendation: buy more shoes. Buy good ones. Buy good ones. Now there are other causes, but those are some of the main ones. Number 6, insurance companies, including Medicare, usually pay for part of the procedure and therapy needed. That's true. Part. Some pay all. That's rare. And just so you know, for any of the surgeries, if you have no insurance at all, they'll charge you about half or less. If it's out of your pocket, you get about half price for everything. Now, when you go have a surgery, who's involved? Hospital, anesthesiologist, radiologist, surgeon,
And his
surgeon helper,
and his partner,
and his partner, yes. And then after it's all done,
nurses.
nurses,
Home health therapy.
home
So
health.
6 falls are true.
So you have a lot of people involved when you have it done.
And they'll all cut it by half?
So number
I
6
can't
was
speak
true.
for everybody,
Okay.
but the answer is yes on most of them.
Okay.
7, most joint replacement recovery time is less than 6 months. False. They may tell you that, and they say, oh, we're gonna give you a new hip, and 10 minutes after surgery, we're gonna have you walking up and down the hall. Well, guess what? You're not better. I had a lady yesterday in class who said, I had my both knees replaced 11 years ago. I think my recovery took about 10 years. That's what she said. The most common age for replacements, between 60 and 80, true. 15 to 20 years is expected longevity of the joint. That's now we're talking about the insert, that what they put in your body. I had a friend in Denver who worked with me, us in the temple, who had a titanium rod put in his spine. Two of them, because he was hunched way forward. He also had to carry a pillow around. He always looked like he was in pain. The titanium rod in his back broke.
Oh.
And he had to have it done again. Now, wasn't that a good day? It was a good day for the hospital and the doctor, but not him. That was great. It was a horrendous pain and problem.
So is that true? 15 to 20 years?
For the
material used.
For the material.
Okay.
True. Appropriate functional motion assessment are important to maintain longevity and successful recovery. True. Now, some people, my dad had a hip replaced, and when I was in chiropractic school, when I came home, I laid him down, checked him. His legs were different. Now, that's not I didn't blame the surgeon. When they're doing the hip, they do the best they can, but they were off. So we had his shoe bent up, so he was even when he stood. So we're at the other side, and the knee, because of a wobble.
My friend had 4 or 5 knee replacements. They just weren't working. And on the last one, her knee came out and it was just it didn't hurt, but it was not attached anymore. And they said, your joints are really loose and this just isn't working for you. And she was tall,
yeah.
and it just wasn't holding. And so they said, we either amputate or we fuse the knee. So she got her knee fused. But every time she'd gotten her hip done or her knee done, she was having to adjust the other shoe, and this time they made it shorter so she didn't have lifts in the other foot, and they made this foot shorter because it was going to be dragging, and now this knee over here is giving her fits because she's walking funny to swing that straight leg. And I thought, Atlantic Ocean, honey, and she's early 60s, I think.
So what do you do with that case like that? What I would do would be to do an assessment and do what is called counter stress. Counter stress. That's where you do the opposite. So with her hips being uneven, her spine is doing all kinds of hard work with the wobble. If she were to do something simple like sit on the T-zone every night to undo the torsion and the rotation, it would help buy time for her tissue. And then make sure that the legs are even. Now she had it fused, they don't undo those kind of things, usually.
Well, there's nothing to undo because there was nothing, it was not even workable anymore.
Yeah. So she would probably have a major nutritional chemical weakness in her body because her muscles are not strong. It probably has nothing to do with her height. It's probably nutritional weakness chemically. Number 11, bone and bone is an overused marketing pitch used to promote surgery. True. Very true. 12, early onset of pain is the best time to assess and modify motion, balance, and alignment with the intent of preventing the need. True. Now, here's the problem. Number 1, you have to find out what the weakness is, where the wobble is, and learn how to do appropriate counter-stress therapy, and then stick to it, because it's slow. The bad news is it's always slow. And a lot of people who have joint pain, whether it be toes, elbow, shoulder, hip, knee, spine, pain is a primary indicator for the surgery, not lack of function. And they want to try anything to help lower the pain. But if they do repetitive microtherapy, like my friend Helen, the hip, I would never have thought that the hip would grow an extension. I didn't know what it would do, but it did. I didn't know that the hip femur head would grow a new smooth covering, but it did. Right now I have a young man who's now 13. He came in when he's 11 and his knees were in and out, his feet went out. So when he stood, his legs went out straight. We had him do a book between his knees at bedtime and do the foot flatter slowly with his feet together as close as he could get them. Now he's 13 and his legs are normal. His body remodeled his knees because we did counter stress. Before, every time we walked or ran, it would hurt his knees and his ankles and his low back. Now he has no pain and they're straight. Most joints lack the ability to remodel and regenerate. Faults. 14. Ibuprofen is the best first choice for joint pain.
Want to say true. But I bet he's saying false.
Yeah. It can be one of the choices, but not the best one. The best one is to identify their weakness and immediately start to line up the surface, line up those joint surfaces so they slide and glide, keep them lubricated, keep them mobile, and allow time. 15. The average cost for total knee and hip replacement is between $1,000 and $2,000.
False.
So what do you think the cost would be for a hip replacement if I have good insurance?
The deductible.
35,000.
40,000
You say without insurance?
with insurance.
Oh, with insurance.
I'm really good. I work for INL.
The deductible, whatever that is.
What do you think the total cost would be? Not to me, but when we add up all the therapists. and
70?
doctors. Pardon?
70,000?
Do a hair 80.
80?
Do a hair 90.
What is it?
More than 90.
Oh, really?
Really?
Really? What about a simple knee? A simple knee replacement. Okay, thank you.